Today we have Bonnie Clark and Kathy Fisher from DSHS joining us for our question and answer sessions. But now I'd like to introduce our presenter for the day, Mary Woods.
Good afternoon, everybody, and welcome to this session on Spenddown. We were actually kind of excited to do this in that our last few sessions have all been about Affordable Care Act, and while Spenddown touches on that, it is uniquely different than what we've talked about in our prior sessions. So with that said, we'll go ahead and get started. And so our topics today is we're going to talk about Spenddown and how it affects pregnant women, children, and individuals who are aged, blind, or disabled. So we'll go ahead and Spenddown. What Spenddown is, and we're going to assume maybe some folks on the phone are not as familiar with it, but it is a medically needy program that is offered by the Healthcare Authority. It offers slightly a lesser benefit package than our categorically needy scope of care, but still a very rich and robust package. So it still has hospital care, and it still has inpatient services and lab work and prescriptions and those things that CN coverage has. And it's offered to individuals who have income above the Apple Health or Medicaid standards. But it isn't available for all of our Medicaid coverage groups. Who it is available for, the groups that we have listed below. It's available for individuals who are considered aged, blind, or disabled. It's considered available for children, individuals under the age of 19 here in Washington, and for pregnant women. You'll notice on this group who's not listed is it doesn't list our adults who are related either to our TANF or Family Medical or adults who are related to the new expanded adult group. Those individuals, even if their income is above the Medicaid standards, they're not going to be eligible for Spenddown. So when an individual applies for health care coverage, the agency looks at countable monthly income. And if the monthly income of that individual or household exceeds the categorically needy Medicaid standard, the individual then is not eligible for categorically needy Medicaid, but has the option to be considered for the Spenddown program. So individuals who are age, blind, disabled must also meet a resource limit, and with some exceptions for long-term care clients. And pregnant women and children actually do not have any resource limit or asset test for their Spenddown. So Spenddown is the amount of medical expenses for which the individual is going to be responsible for. And when we talk about it, we sometimes like it to an insurance deductible. So these include expenses incurred not only for the individual that might be eligible for Spenddown, but we can use expenses that other eligible household members incur as well. So for instance, I may be looking at pregnancy medical Spenddown for the wife in the household, and even though her husband is not relatable and I can't do Spenddown for him, I would be able to use, if they're eligible, some of his medical expenses to meet her Spenddown. So like a deductible, the individual is going to be liable for those medical expenses used to meet their Spenddown that occurred prior to the base period. And the Healthcare Authority will not pay these expenses. So those are going to be the responsibility of the household. After, though, an individual meets Spenddown, the Healthcare Authority will pay for the remaining balance of any eligible medical expenses incurred within the Spenddown period. So Spenddown requirements. The amount of Spenddown depends really on three items. We look at, like we do for other Medicaid programs, the number of people in the household. We look at the amount of countable income that the household has after we give them a certain set of deductions, and medical programs for which the individual is eligible for. So eligible deductions then for both the children's and the pregnant women's program are as follows. They get a 50% earned income disregard. If they're paying court-ordered child support, we can allow that as a deduction, and we can allow child care expenses. So we put here on the slide just kind of a general example of a case then. If we had employed parents with a combined monthly gross income of $5,300, they could receive a 50% earned income disregard, which means that we could take off from that $5,300 $2,650. If this family was also paying child care costs of $250 a month, we could remove that as well from their countable income. And that would get their countable income down from $5,300 to $2,400. Since there's a 3-person household, we would be looking at using the 3-person medically needy standard, which is $721. So this family would be over the monthly income limit by $1,679. And we'll talk a little in a few slides coming exactly what that would mean for them. Karen, before we go on, I wanted to point to one thing. As we move through here, I don't want you to think that we have a typo on our slide. When I refer to the medically needy standard, you will notice that when we talk about a 1-person, a 2-person, a 3-person, I don't think it's moved to 4 yet, has it, Kathy? 1, 2, or 3-person standard, they all have the same income standard, which is unique to this program and very unusual. And as we get further out into years, as we go down the road, every household size within that MN category will be using the same 721 standard. So don't think that there's a misprint if you see that in the sheet, because it's real unusual that it doesn't vary from household size as we move out. So next slide, Karen. So then the other way that we can be related, or an individual can be related, is if they're aged, blind, or disabled. And just as a reminder, and I can't remember if we say it in a future slide, but aged means over 60, 65 or older. And then blind or disabled are the criteria used by Social Security standards. So again, the disability would have to be something lasting more than a year or something that would lead to your death. So this is not an incapacity but a disability. So for those individuals, they receive a $20 income disregard, and I think we've got earned here, Kathy, but I think it's just a disregard. We got that wrong on there, so at least I caught it when I spoke here, and not when I read it for you, sorry. So it's just a $20 disregard, and in fact, typically this disregard comes off of the unearned income first. And then we have a 65.5 earned income disregard, and we'll show you that here in just a minute. And then we do allocation and deeming to both what we call a non-applying spouse. So in an example, if I have one individual who's 68 and perhaps their spouse is in their early 60s, they would not be related to SSI. They would be a non-applying spouse. And to any children that might be in the home as well. In today's overview here, I think we can all thank our lucky stars that we will not be going into detail on how we do deeming and allocation back and forth between the non-applying spouse and children. Safe to say that it is complicated, and we would certainly, if anyone was wanting that more in detail, we've got some cheat sheets if you want that we could share, but it's just important to note that a deeming process does go on when we're looking at this MN budget. But for many of you, what you will often see is a single individual who's applying for Spenddown. So in this example, we have a 68-year-old that's applying, and he receives retirement, Social Security retirement of $800 per month. As you can see, he gets the $20 off of that, bringing that to $780. He works part-time, earning $150 per month, and we take off $65. We divide that, the 85 then, by a half, and his countable earned income is then $42.50. We add that back together with his $780, and his income then would be $822.50. Based on the one-person MNIL standard, which again is the 721, you can see that he would then be over the monthly income limit by $101.50. Okay. Involved in Spenddown is a word called base period, and this is a period, is the number of months that the individual's income is going to be counted for. And the individual may receive coverage for all or part of that base period depending on when they meet their Spenddown. So a base period can either be 3 or 6 months increment period of time. And the excess monthly income that an individual has each month is multiplied by the number of months in their base period. So if we go to the next slide, Karen, we went back and we used our 68-year-old gentleman. And if you remember, he was over the monthly income standard by a little over $101 a month. And if he had chose a 3-month base period, so let's say he came in and applied in June and wanted his base period to be June, July, and August, we would multiply that $101.50 by 3, and his Spenddown amount would be $304.50. If he chose a 6-month Spenddown period, we would multiply it by 6, and his Spenddown would be $609. What that means is that before we could issue any Medicaid coverage, he would have to incur or show that he had past unpaid medical bills that he was still responsible for in the amount of either $304 or $609. Once that was demonstrated, then we could open him for the remainder of that base period. I think it's important to note that it's only for that base period, though. So unfortunately, if you pick a 3-month base period, while you have less out-of-pocket expenses that you would have to meet, you would have to meet those once every 3 months. So in essence, if you're wanting coverage for the full year, you'd have to meet that 4 times a year.
And reapply
4 times a year. So when the Spenddown amount is high, sometimes the 3-month base period is more advantageous to the individual. And when the Spenddown amount is low and can be easily met by the individual, sometimes the 6-month base period is longer because they don't have to reapply. There's several things that workers and even those who are helping families want to take into account in this and we'll talk about it in some future slides, but if you have some unpaid medical expenses that you're still that the individual is still responsible for, and they haven't been used to meet Spenddown in the past, it may be more advantageous to use the higher amount, get the longer base period, and sometimes you can meet your Spenddown the very first of the month with those unpaid expenses. So medically needed coverage then begins once an individual proves they've incurred medical expenses that meet their Spenddown. Proof of unpaid bills must be current and include the original dates of service. Coverage can begin on the date of service that the bill was during the bill that met the Spenddown period, and that's unless we have to remember if we're using an old bill, the soonest that we can go to is the month of application for you. So it's not going to go back to do that. And then retroactive coverage can be requested up to 90 days prior to the date of application for any month where an eligible medical expense has been incurred. So just like with our other Medicaid programs, we do have a 90-day look-back period, and we can go ahead and set up Spenddown for that retro period. Okay. So allowable medical expenses then, and there's a list of them, and we just try to combine the most common ones here for you. but especially in the group of our aged blind disabled, they're going to have Medicare premiums and co-pays and co-insurances from their Medicare. Medical expenses owed by the individual after all primary insurance payments or adjustments have been applied. And it's kind of curious to note, and Kath will correct me if I've got it wrong here because it's been a while since I've done this, but if the bill is incurred during your base period, so you apply in June and your base period is June, July, and August, if the bill incurs during your base period, it can be paid or unpaid. If the bill is incurred prior to your base period, so the bill incurred back maybe 6, 7, 8 months ago, then it must still be owing and the individual's responsibility to be used in the as an allowable spend-down expense. And the only exception to that, and this was a good reminder for me because in getting this ready, I'd forgotten this rule that we changed just a few years ago. Medical expenses incurred 90 days prior to the application month are allowable if retro coverage was not approved. And that means they're allowable whether they're paid or unpaid. So that's the only kind of exception to that unpaid rule for past owing bills, is if it happened just prior, in the 90 days prior, and you didn't have Medicaid coverage during that time, then we can go ahead and allow that bill even if you paid it. Medical supplies, syringes, prescription expenses, over-the-counter drugs if they're provided or prescribed by the doctor, all of these then are allowable medical expenses. As well, other services prescribed by an allowable medical practitioner, co-payment bills by individuals towards their bill, mileage for medical purposes, but a log has got to be kept and turned in. And then, of course, all the kinds of hospital services, so emergency rooms and clinics and nursing facilities expenses. All of these things are allowable medical expenses. Okay? So as an example of spend down then, we have Martha, and she's 70 years old and applying for Apple Health medically needy coverage. Her Social Security is $1,166 a month, and she's over the SSI monthly income limit, and this is the MN standard of, the CN standard of 721, and she's over by $525 after we've deducted the $25 from her Social Security benefit, or 20, excuse me. Thanks, Kath. That's all right. Martha is found eligible for a medically needy spend-down program for the aged. She selects a 6-month spend-down base period, April through September, and her spend-down amount is $2,550. And we got that by taking the $425 and timesing it by 6 months. And this means that Martha is going to be responsible for $2,550 in medical costs she incurs during those 6 months, or if she has allowable expenses in the previous month that we can use. So on May 12th, Martha had a surgery, and after Medicare pays the eligible 80% of the bill, there remains a balance of $5,200 that Martha is responsible to pay. And based on her participation in the MN program, she's liable for, again, we said $2,550. Once her spend-down's been met, Apple Health will pay the remaining amount of her bill, and her certification period in this example would be from May 12th through September 30th. If Martha's monthly income was below $721, she would have qualified for our CN Medicaid, and she would not have had the cost for having to meet spend-down, and she would not have had, and she would have gotten a 12-month cert period.
Can I just mention something?
Oh, please,
Mary?
jump in.
So I think in this example, since she had applied in April, her base period would have started April 1. And so she's not going to have coverage for the whole of April and right the way up through May 12th. And so I think it's really important that if you're working with a client, that you make sure that they present all of the bills that they have, not just the one for that particular visit that you might be working with them. Because if we open it on May 12th, then anything that she incurred prior to that, even if it would have been payable under Medicaid, isn't going to be covered because she wasn't actually eligible during that period. And so I know when I used to work here and we were working on a lot of the questions we had were around, well, you opened it on this date, but we had this bill, you know, from prior to the hospitalization, and what do we do?
Yeah.
It's really important to get those all together
Prior to submitting. It really is. It really is important. So that's really a good point, Kathy. Thanks. Let's see. I think we'll go to the next slide, Karen. So then reporting changes. For pregnant women, children, and blind disabled program, it's important, and I think this is aged as well, it's important to report changes timely. A decrease in income can make an individual eligible for no-cost medical during the spend-down period. So what this is really saying is if any individual has a change in their circumstances, you should report those changes. And in particular, if income goes down for family members, we can either recompute the spend-down for them, or in some cases, they'll become eligible for CN coverage, which is always much better for a family to be on.
I think it's really important for the pregnant women and children, because then they get continuous eligibility moving forward. So.
Absolutely. That's good. So then our last slide here before we stop for a few questions is, at the end of the spend-down base period, an individual must apply for health coverage to be determined for a new base period. And this is true of children as well. So for children, as you know, we have, as Kathy mentioned, 12-month cert periods, but not in the spend-down program. So once they've gone through their base period, whether it was 3 or 6 months, even if it's a child, they're going to have to reapply and set up a new base period under this spend-down program. So with that, I think we'll stop for just a moment. We'll check with Karen to see if there's any questions on what we've gone over that we want to try to field.
Okay.
And hopefully Bonnie and Kathy can field those.
Great. Okay, so question number 1. Are workers automatically applying 6-month spend-down base periods unless asked by an applicant for a 3-month spend-down? And is there a choice on the new application?
That's a really good question.
Workers are automatically applying a 6-month spend-down unless the client requests otherwise.
Yeah. And the system that we use defaults to 6 months,
yeah.
And then can be shortened to 3 months. But
unless specified, we will be doing 6-month base periods.
So I think, and I know because we just worked on our application, I know that we don't offer that question directly on the app.
It does not.
It doesn't say that. So that's just something for, I mean, I appreciate that question because it's something for us to think about as we think about, we're always revising the app a little bit and tweaking it. And I think we'll take that away to think about, is there a way that we can incorporate that question where folks would understand it to do, because that would be helpful. And I think as you're working, because I think on the phone we mostly have community-based organizations and maybe some hospitals and IPAs. I think as you're working with individuals, I think it's important to note that if you know someone has unpaid medical expenses that could be used to reduce their spend down, or perhaps an eligible household member like a spouse who's not going to be able to get spend down but has monthly expenses, and you know that those expenses may meet their spend down, those are things important to kind of talk to workers about and even put a note. Or if you know for sure they just want a 3 months, you could write that right on the application for them, and workers would see that and take that action. But I think we'll take as an action item here to think about that when we redo our app and see if there's a way that we can ask that question.
And I think without going into a really complex explanation of how our system prioritizes expenses, there's certain type of expenses that get prioritized higher than others regardless of when they're incurred. And so if you're using like a spouse's bill, somebody that's not applying, or if you're using Medicare expenses, because they get prioritized higher, they can open coverage sooner.
Yeah.
And so, you know, it may end up by using those other expenses that they could have coverage opened before even the date that they incurred the rest of it. So
Yeah.
it's a very complicated program, and it's good to know that it's good to get everything in together.
Right. I think that's really the key thing. I think be sure that you just turn in any expenses that you think would be allowable. Be sure that you turn them in and try to turn them in all at the same time and let the worker work on that. That'd be great. Super.
Okay. Is there assistance or a review process available if someone has been turned over to collections for unpaid medical expenses?
There is not an assistance if someone has unpaid. I'm sorry, repeat that question one
The
more
question
time.
was, is there assistance or a review process available if someone has been turned over to collections for unpaid medical expenses?
If they're unpaid medical expenses and they're already on a spend down, we would be able to use the expenses to look at meeting the spend down. However, if the client does not specify they're looking for medical assistance ongoing, we cannot, there's no assistance to cover those bills that have gone to collection.
Okay. If a person meets their spend down amount and is opened up on a medically needy program, is dental coverage included as well, or does this just cover medical?
Yes.
No, yeah, dental.
Dental is covered. I know that the difficulty out in the field is to find a dentist that will accept that coverage, but it is included in the MN benefit package.
Okay. Oh, here's a good one. So on the HCA Medical Income and Resource Standard Sheet, effective 10/1/13, MN income standard is listed as a $710 limit, not $721. Am I looking at an old sheet?
Yes.
Yeah. So the new one was is April 1, and it is updated on the HCA website.
And in fact, this standard changes in January.
Yeah,
every year.
Oh, right,
Yeah.
January,
So,
right.
If you look at the January, even if you look at the April one, it's going to show that it was effective in January, and it follows the SSI payment level. So it's the same amount as you would get if you were on SSI.
Okay. Can one spouse be on MN spend down and the other spouse be on MN?
I don't want to say that it could never happen because, you know, you may always think of a time it could. I would think in general terms that shouldn't be happening because what happens is you're either both applying, in which case we're going to treat you as a couple when we look at your applying, and we won't be doing this allocation and deeming that we spoke about, or you're going to be one of you applying and one non-applying, and the non-applying spouse would never get Medicaid because they're by definition not applying. So I don't want to get into it. I think 99% no, but there's always a 1% chance you might come up with an example, but I would say that would be highly unlikely, and I can't think of a time. Can you guys?
Oh, well, she revamped the question.
Oh,
She said, whoops, I meant one spouse on MN spend down and one on CN, categories of needy coverage.
Yeah. I mean, I think you could, especially, I think a good example would that be we have a higher standard for pregnant women. So you could have a woman who is pregnant and her husband might be disabled and getting Social Security disability, and their income may make him be MN and she could be CN.
I think where I would say no is if they're both looking to come into that SSI-related hallway, in which case you couldn't have one on spend down and one on CN if we're both looking at that same program.
Yeah, I can't imagine
when
it
you're on
happening.
different programs, that's perfectly feasible.
I have run into a problem with a children's application where they have not been the patient has not automatically been put on a spend down, but was sent a letter asking if they want to be put on a spend down. This way, we don't even see a possible spend down in Provider 1 anymore. Why has this changed from the automatic processing?
Who is this? Who's the first name of this person?
Kim.
Kim, thank you for leading us on to our next section because we're actually going to talk about that. So, Karen, I'm looking at the clock, and I think I'm going to continue on.
We can come back
just
to
so I make sure. But, Kim, we're going to talk about what you're asking about in this very next session. All right, so go to the next one, Karen, on how to apply. So now we're going to talk about spend down for children, and this is really what Kim was getting to. This is spend down in this new world order where we have a health benefit exchange. How does this all work, and how does the child get towards spend down? So as all of you know from our previous webinars is that we're using the Health Benefit Exchange to do eligibility for children here in Washington. And so almost all children are going to go through the Health Benefit Exchange to have their eligibility looked at. But if you're a child who has income over 312% of the FPL, then you would not be eligible for our Apple Health for Kids program at that limit. If your household has income below 400% of the federal poverty level, that family may very well be eligible for what we call the health insurance premium tax credits, or you might know of it as the exchange or tax credits in the exchange. So what happens in this is that at the healthcare authority, the MEDS office, receives a daily report of all children who went through the Healthplanfinder the day before and were denied coverage because their income, family's income, was above 312%. And what the healthcare authority is doing then is that the eligibility staff then sends the family this request letter sharing the option of the Spenddown program for them. And once we receive that, a confirmation back on whether they want Spenddown or not, then we'll go ahead and proceed with Spenddown. The reason that we set this up this way, Kim, is that if a family's moving through the system, unless they've had a high unpaid cost, and perhaps what's generating them to apply is that their child has just needed a hospital stay, in those circumstances, families will probably be very interested in looking at Spenddown. But for the vast majority of families moving through the exchange, if they have healthy children, then what's going to happen is when they trickle to tax credits, that's probably going to be the best option for that family and for those children. Because if you kind of go back and look at a previous slide, you will notice that when we were talking about that one family, you will notice that their income was like at 12. Karen, can you go back real quick? What was their income at? It was at 12.
Which one?
The family one. Let's go back a little bit to that one family example. Their income was they were over income by $1,679. Even if we picked a small base period for them of 3 months, I'm not going to do the math because you know I can't, but that's going to be close to $5,000 that they would have to incur in expenses before we could give the child medical. So certainly if the child has been in the hospital, it's very possible, if they've only even been in there a day, that they could have incurred that much in expenses. But for all those families applying through the exchange whose children are relatively healthy and maybe their only expense was a trip to the pediatrician for an ear infection this month, they're not going to have incurred those expenses. And really tax credits, or if they're over 400%, purchasing a full qualified health plan is a better option for them. But for families who have had a medical need for a child or have high unpaid expenses in the past, Spenddown may very well be appropriate. And that's why we send out that letter and ask families to follow up with us. Karen, if you can go to the next slide. For pregnant women then, the same thing really applies to them. Pregnant women are going to be going through, in almost all cases, the Health Benefit Exchange, and we're going to look at eligibility for them. But if their income is above 198% with the disregard, then they're going to be, and their income is between 198 and 400%, they could be a woman who might be eligible for tax credits. If her income's over that, then she could potentially purchase the full QHP program. The Spenddown program for pregnant women is going to follow the same procedures as we do for children on the previous slide, in that we are going to pull a report every night of pregnant women who were denied coverage because of income. And we're going to then send them this Spenddown letter that I'm just going to show you next. So Karen, can you click to the next slide? So Kim, you're exactly right. We are sending a letter that looks that has words very similar to this on it, and it just states that if you're a child or pregnant woman, you may be eligible for coverage under Spenddown. When you apply for Washington National Health, your income was above the standard for free or low-cost coverage. And it talks about what Spenddown is, that there's a deductible, and the amount of it is going to be based on your income, and that no coverage will be authorized until that deductible is met. If we go to the next slide, Karen, it also tells them that if they'd like to enroll in Spenddown, that they can call the 1-855 number, and that really is the number directly to the MEDS office, where workers there should be able to help them. And in that case, when they call or they can write us, I would say on either option, if they're calling or they're writing, I would encourage families to put what they, if they think they're going to want to go down this Spenddown route, they're going to want to tell us what base period they'd like. So, you know, if they just had a child that had a huge hospital bill, they're certainly going to want to perhaps look at a 6-month base period, because we might be able to get them in and then have coverage for a full 6 months on that. The next slide that we have just shows you the rest of that letter that they're going to get.
Oh, no.
I think this
one, sorry.
Oh, yeah. And
this
then
is the second half.
Yeah, and then we have, I think we had another part to it. Karen, one more time. I went over this one. Go one more time.
Here was the first one.
Okay. Second, and then do we have
second.
and then we have a third?
Nope.
Oh, that's it. Okay. I did, I think. Go ahead. Let's click on this. And
oh.
Then, oh, yeah.
I lied.
Trying to trick me.
This is the denial letter.
This is the denial. Okay, yeah. So, you guys, one other thing I wanted just to share with you on Spenddown for pregnant women and children, and something really important to think about as you're helping them, is I think you all know that tax credits or purchasing a full QHP, full cost QHP, both of those programs, the coverage is always prospective. So if I apply today in June, the soonest I can get coverage is July. So if you're working with a family and you happen to be a financial counselor in a hospital, and when you enter the family's income, the child or the family is over income, know that that tax credit is never going to help you if you've just had that hospital event. And that really the only program that's available for that family is probably Spenddown for that hospital event. And there's no reason why the family has to wait until they get this letter from MEDS. You can, if the family is sitting with you, you can initiate this call to MEDS right then and there and talk to them about saying, you know, Mrs. Jones is interested in looking at Spenddown for their child. We've just admitted them. They're going to have a rather large bill. They don't have any other insurance coverage. So you don't have to wait for that letter to be sent out. If you're helping a family, you can initiate the call and work with the family right then and there. But for families who apply on their own, sitting at home by themselves, they will receive this kind of letter to inform them about Spenddown. On the next slide, then, we do have a picture of what the denial letter would look like. So we're going to send that letter, the request letter, to the family, and then we give families about 10 days, between 10 and 15 days, actually, to respond to us. And if we haven't heard from them on that, they're going to receive a denial letter for Spenddown that lets them know that they did not contact us. But if they want us to reconsider that, they have 30 days to go ahead and contact us, and we'll reconsider their application for Spenddown. As with all letters that we send out, they have fair hearing requests on these as well, so families can certainly request a fair hearing at any time. It also lets them, it reminds them that if they don't want to pursue Spenddown, that they can continue to look at the tax credit or the qualified health plan option through the exchange, because that can be confusing for folks in this new world that we're in. On the next slide, Karen, The next slide then is how we're talking about our spend down for our aged, blind, disabled, and really the in general the change into the exchange and how we're doing eligibility for that, and even for most folks for our new adult group, has had little impact or any on spend down for adults who are aged, blind, disabled. The rules are the same as they were before. How they apply for those benefits is really the same as it was before. They can continue to apply through DSHS for these benefits. So an individual with income over $721 for a single person or over $1,082 for a couple may qualify for spend down if they're age 65 or older, if they have an individual with a disability who's under age 65 and entitled to Medicare, or are an individual with a disability not entitled to Medicare but with income over 138. And those two bullets there, what we're really trying to point out or to remind folks of is that even if Social Security has determined me disabled, if my household income is below 138, I can still receive coverage through the new expanded adult group. And I can get that coverage, which is going to give me the alternative benefit package, which is even better coverage than CN scope. And I can get that without having to meet any kind of spend down. So we're always going to want to direct individuals who are under 65 and not yet entitled to Medicare to the new adult group if they have income under 138. But if their income's over 138, then they have the option of looking at spend down, as other folks do. But unlike the new adult expanded group, spend down for aged, blind, disabled does have a resource or an asset test, which is $2,000 for a single individual and $3,000 for a couple. And if it happens to be a family with a disabled member, then with each child it adds $50 to the resource standard. So it goes up a little bit if it's a larger family. But it is still a pretty restrictive resource limit for this program. So the next slide then tells you how to apply for the Aged, Blind, Disabled Spend Down program. It gives you the contact information. You can apply using Washington Connection. You can also apply using the paper application, which is the 18005. And that link there will give you a link to that form if you want to download it and print it. And then you're going to mail the application if you decide to do the paper application to the P.O. Box 11699 in Tacoma, or you can fax it, and it gives you the fax number there. You can also drop them off in person at any local CSO, or you can call CSD's Customer Service Center at 1-877-501-2233. So there's lots of ways to connect folks to spend down. So with that, oh, thank you. Kathy reminds me, you can also call. I had another slide and I just moved on. We have it for long-term care programs, and those programs are still worked by DSHS, but they're worked at with ALTA. And for those individuals that need to apply for long-term care coverage or for support services, the waivered service program, they also can apply online through Washington Connection. They can use the paper app, but their mailing address is slightly different. So theirs is P.O. Box 45826, Olympia, Washington. They have a different fax number, 855-635-8305. And individuals there can go to any local home and community service office or call their local home and community service office, right? Yep. Yeah. And I think, guys, if I remember right, at the Washington Connection site, can they link and find the home and community service offices as well as the CSOs? I can't remember.
I don't know, Mary.
Yeah, we'll have to check. Yeah. So we'll check and see, and maybe what we'll do on this slide, Kath, if they can't, or Karen, maybe before we send out this PowerPoint, maybe we can add the link So we'll add the link so that folks can be sure they can find those community, home community service offices. Great. So I think we've got time for a few more questions.
Actually, why don't we finish up and then we'll ask questions at the very end.
I think I'm finished. I've got the resources?
Yeah.
Oh, okay.
Let's do this and then we'll answer a few at the end.
Okay, so we're going to go real quick through the resources just to remind everybody. On the first one is just, again, the Community Service Centers referrals list, both for HCA and Health Benefit Exchange and DSHS and for meds. So it gives you all the contact information there and the times when you might want to call those individuals. The next slide has our HCA community-based specialist, and this is just a reminder to folks that I think in almost every county now we have a healthcare authority community-based specialist there, and they really are a meds eligibility worker. And this link here will show you where the individuals are located in your county. And we really encourage all of our community partners to form great relationships with those folks in their counties for help. And this helps not only in maybe answering questions on Spenddown and things like that, but also questions in regards to, oh, I got an error when I'm trying to enter this case. Is there, and it's one that it looks like you might be able to fix it if you can look it up for me in ACES. And so it helps with that kind of work as well in getting applications through. So this link will show you where those folks are at. And I think they also wanted me to know that if for any reason that your worker in your county is not available that day, there's no restriction. You can call a worker in any county to help you. The next two slides just are a reminder of our area reps and their contact information. And they're always available to help you by phone or email if you have questions or concerns on Spenddown or anything else. And then in addition to that, we've listed our resource websites here. I think that it's got our area reps, but I think the one that I think is really helpful and a good place to go to, in fact, I really do use it myself, so I don't have to keep track of all of the clarifications and memos that we sent out. But if you go to the training and education page, it'll have a link to all of the webinars we've done, but also handouts like how do I do a KO1 for an institutional child, which is always hard to remember all the processes on that. That memo or handout on the steps to do it is located right on that page, and I think helpful for folks. So I would encourage you to save that maybe as a favorite. As far as future webinars, Karen, if we go to the next slide, it's really to be determined. We're happy to continue to do these either on a monthly or a bi-monthly basis. And what I would encourage you to do, if there are topics that you would like to hear about, if you can send those to the Medicaid Expansion 2014 at hca.wa.gov. We'll be happy to look at it. We're happy to partner with DSHS if there are things on medical that impact us, and we'll invite them to come and do these webinars jointly. So if there's topics, please feel free to send us something, and we will announce them as we go forward based on what we get there when our next webinar will be. Okay. Good.
Okay, so we just have about 5 or 6 minutes left for a few questions, and you guys are asking really great questions. I wish we could answer them all, but we just don't have enough time. First one is, if someone receives charity care to cover copays and deductibles, can that amount be applied towards one's Spenddown?
No, you cannot, because it's no longer the responsibility of the individual, and it's not unpaid at that point either.
Okay, how about, can you use copays and deductibles from a QHP plan on the exchange to meet a Spenddown?
Yes, you could. Yes, you could. In this new world, you could.
That just makes my head hurt, Mary.
Yeah, I know. You can do it. So very good. Yeah, great question.
Okay, let's see. Here's a question from an in-person assister. If we are not able to get a hold of the patient and we've been told by a representative that the patient has been sent a Spenddown letter asking or Spenddown request letter, can we as a navigator send in bills to meet the Spenddown even if the patient has not yet responded and stated that they are interested in the Spenddown?
I think we really need to hear from the family member that they want to pursue that. As with all Medicaid applications, it really is a family's choice on whether they want to apply for Medicaid. So, you know, if you could get them on the phone and do a conference call and then call while you've got them conferenced in, that would certainly work as well.
Okay, let's see. If someone applies in Healthplanfinder and checks the disability box, is this reviewed or referred to for an MN determination, including request for additional information?
Yes.
Okay.
It generates a referral to DSHS so that we know somebody's indicated that they have a disability and that they want us to look at a disability-based program.
And we will send a follow-up letter.
And you guys, that's true not only for disability, but if they need long-term care services. So, yeah.
Let's see. So for a client who has already submitted their retroactive request form, can a HCA community-based specialist in our local county process this pending retro request if the information's already been turned in?
You know, I think so, but let me, Karen, can you mark that one, and we will get back on that. I don't want to speak directly because I don't supervise the staff directly, so I want to make sure I ask their supervisors. But meds in general would be processing that.
Yeah, and I think they can, but I know they can answer questions about retro, but I'm not 100% sure if they're actually processing.
And part of it may be, to be really honest with you, it depends on you know, the experience of staff. So if we have someone brand new, they may not quite be up to speed on how to do that. So I wouldn't want to say absolutely every time they would do that, but yeah, we'll follow up for you.
Okay. Can an authorized representative call and request Spenddown?
Yes, they can. Because, and remember the difference, you guys, and there is a unique difference, and we're going to kind of be talking about this further. There's a difference between being an in-person assister and an authorized rep. And an authorized rep, you are someone who says, I know the information and circumstances on this individual, and this individual is giving me the authority to act on their behalf and to answer questions on their behalf to apply for or receive services. And in most cases, without the client right there giving individuals information, they're not going to be able to do that. So, an authorized rep, if they don't know the information, is going to the client and getting that information to do that. So it really has to be, it's very specific, and the client is asking you to do that on their behalf.
Okay, let's see here. Okay, so lots of folks asking if they can get a copy of the PowerPoint slides. So everyone who registered by 5 o'clock last night for the webinar did receive an emailed copy of the PowerPoint slides presentation that we just reviewed. And then we'll be doing a little bit of updating to the slides, and then posting in about 10 days a recorded version of this presentation as well as those updated PowerPoint slides. And that was on the training, that'll be posted to the training and education webpage, which is the second link on this slide right now. Okay, I think we're all set. All right.